Hello, Dental Online trainers. Dr. Dennis Hartlieb here with a little mini clinical course, one of our little pearls that we're going to share with you called the Composite Pit Repair. So for anyone who's been out there and you've done composite work, any composite dentistry, you know it's possible to get a little pit in your composite. So you really have three options when you discover that you have a pit in the composite. Option number one, you can try to contour the pit out. So you can sort of gauge the depth of the pit and figure out, can you reshape or recontour the tooth to eliminate the pit. But you have to be careful because sometimes you can actually destroy the contour of the tooth or ruin the contour of the tooth by over contouring. So if that's not an option, then you really have two options. The first option, just leave the pit and go ahead and polish. The downside with that is those pits tend to accumulate stain, and so it's likely the patient will come back at some point and you're going to have to do a pit repair afterwards. So I prefer the second option, which is to just deal with the pit while I have all my composite materials available. So let's go ahead and get into our pit repair. So I have a composite veneer that I made that has a little pit in it. So let me show you the pit. And there you'll see the pit right along, sort of towards that distal facial area right in there. All right, so here's what you need to do is if you've already started polishing the composite, you need to take a step back and roughen up your composite because composite doesn't stick very well to polished composite. So using a mandrel, I'm going to pull out one of my coarse flexi-discs from the Composite flexi-disc system, and then I'm just going to roughen up the tooth using my coarse disc. And in that way I know that the composite is going to stick really well to it. Then just go ahead and rinse it off and dry your tooth. If you're on enamel or tooth structure, then you need to etch the tooth. But in this case, I'm only in composite, so I don't need to go through any etching. All I really need to do is just put on my adhesive. I need to take care of the pit. The pit itself is just a little tiny pit, and I can't get my composite to flow down in there. So what I actually want to do is create sort of a chamfer, a deeper chamfer that will eliminate the pit and then sort of open up that area so I can get composite into that zone. So to do that, I'm going to use like a number 4 or number 6 coarse diamond burr on high speed. So when I use this coarse diamond burr, essentially I want to just work the diamond burr in kind of just sweeping motion, creating a chamfer eliminating most, if not all, of that pit there. Now that I have that pit eliminated, I'm going to rinse and dry my tooth, and now it's ready for the bonding. And as I said, if I'm on tooth structure, if I'm on enamel, then I need to etch the tooth, or if I'm in dentin, I need to etch the tooth. But in this case, it's just composite. So I'm going to take an unfilled resin, just an adhesive. This is from Composite Complete. I have a drop that I put into my dapping dish. And then I'll just use like a little micro brush. And I'm going to paint it over where that chamfer is and where I've roughened up that composite. Set that to the side. And then I'm going to air thin. Now here's the important part. If you light cure the adhesive now, when you put on your composite and cure that and you start contouring back your composite, you're going to see a yellow bullseye where you can see the unfilled resin is cured before you did your composite. So what you want to do is don't light cure the adhesive. It's only meant to be a wetting agent to make the binding materials blend in better to the existing composite. So I've air thinned the adhesive. I'm going to take the same color of composite, the same shade that I used. If I'm starting a new compule, I'm extruding the initial portion, so that pre-oxygenated. And then I'm going to go right in with my composite. Right into the pit, injecting it. And then I use the tooth to cleave off the excess composite so I don't lift away, pulling the composite out of that pit. I'm going to set my composite to the side, and I'm going to pull out an instrument. This is the IPC instrument from Composite, their titanium coated instrument. And I'm also going to use an alcohol gauze to keep my instrument nice and clean. So, wiping off my instrument, I'm going to use gentle brush strokes to blend the composite onto the previously cured composite, creating as smooth as an interface between the composite that I'm putting on now with that previously cured composite. So this is the portion of the technique that takes me the longest amount of time. It'll take me a minute or so, maybe a couple minutes. Take off the excess composite, cleave it off with that IPC instrument. And once I have the composite nice and smooth, I'm ready to cure my composite. I think it's important that you have an adequate or an excellent cure to your composite. If you have a high energy light source, then you can cure for about 30 seconds. If you're using a traditional halogen light, then you should cure for a full 60 seconds. Also, be sure that your curing tip is wide enough to cover over the tooth surface or the composite that you're curing. All right, now that my composite is cured, I'm going to put a new coarse disc on. Or I could use an ET burr or some sort of contouring burr. I like to use a coarse disc. And as you see, as I look through the microscope, got a nice smooth interface, and as I take my coarse disc over the surface, by spending that extra time to make sure that the new composite was blended in smoothly to the old composite, you can see that you won't even be able to detect a margin between the new and the old composite. Once I have the composite nicely contoured using my coarse disc, in the mouth, again, I might use an ET9, I may use some other burrs to help with the contouring. For this exercise, I will just then go in and use my blue disc, which is a medium coarse flexi-disc from Composite. I like this disc because it has a lot of flex to it, as you'll see under the microscope. And then what's great, I'm going to get a really nice sort of satiny finish. It needs a final polish, but for this exercise, I just want to show you how you won't be able to see any of the margins. The pit is completely removed, and then it just needs polishing when I finish. And with these flexi discs, I want to get as much of the disc onto the tooth surface as I can, or onto the composite surface. And when we finish, we should have this really crazy smooth surface. You should not be able to see any of the defects from either the margination or that initial defect. That should all be completely hidden. So that's our little mini tip. That is the composite pit repair. I hope you find this helpful in your clinical practice. I look forward to seeing you at other tips along the way. Good to see you. See you next time.